In this video, I'm going to show you how to use the Dr. Brown's specialty feeder for cleft lip and palate. With this particular bottle nipple, it comes with a blue disc. Bottle nipples that can be used could be level 1, 2, or 3. The usual guidelines are to go to the slowest flow nipple possible when we're feeding a typical baby without the system in, but if your baby has a cleft lip or palate, you may actually need to go slightly higher in the nipple level in order to help compensate for your baby's oral motor skills. When you're putting this together, you want to make sure that this disc is properly placed into the nipple first, just the nipple. So there's the narrower side and this wider lip with the triangle. The triangle or this valve is going to go towards the bottle and the flat side is going to go into the nipple. So you're going to push this into the nipple, make sure that it's nice and flush. Then you're going to put this into the collar and make sure that your nipple is all the way popped through so that it's really pushed into the collar. When you are heating your milk, make sure you heat it without the vent. This helps reduce leaking in that bottle. So make sure you heat up your formula or your milk first, then put your stem in, and then screw on your collar. Now these can be a little finicky, meaning the tighter you screw it, the slower it will flow, but too loose and it can leak. So you don't want it too tight, you don't want it too loose. You usually want to screw all the way on and then unscrew by about a quarter turn so that it's tight but not overly tight. Okay, so now that this bottle is fully assembled, we're going to fill the nipple. So you're going to squeeze the nipple, turn it upside down, and let it fill. Then you're going to turn it over again, squeeze more of that air out, and turn it over so that the nipple fills. You want to have as little air as possible in this nipple for when you're actually feeding. So you can get just a little fussy and make sure that that's nice and full. Now, when your baby compresses that nipple will flow that milk. Okay, so then when you're feeding, make sure that you can monitor and observe how much milk or formula is in the nipple. So doing an upright or elevated sideline position can make sure that you can really see that that nipple is fully working. When you have a fuller bottle, it's easier for that valve to fill the nipple. The less milk or formula you have in here, it can sometimes start to not function as well. But you're always wanting to make sure you have as little air as possible in this nipple. You can see that's nice and full, ready to feed, to help reduce air swallowing to the baby. Be mindful that the blue disc can clog fairly easily, so make sure that that valve is kept clean. Milk fat from breast milk or clumps of formula can get stuck in there and cause it to malfunction. So this is the Dr. Brown's cleft lip specialty feeder that's used for cleft palate, sometimes for cleft lip, to help compensate for baby's skills. And this makes it basically a compression-based system that as the baby just squeezes with their tongue, they're able to move that milk instead of needing to generate suction in their mouth. Now you know.